And welcome back to the big story. We do apologize for that audio hitch there just a moment ago. A big story tonight is shining the spotlight on patient safety and management, especially within the public health system in the country. Joining us for this discussion is Dr. Omar Oluga, who is the Secretary General of the Kenya Medical Practitioners and Dentists Union. He is joining us live from our city centre studios. But amid the blame game of the latest scandal to rock the Kenyatta National Hospitals, nurses have since come out clear, asking doctors to take responsibility for the error committed at the hospital. In fact, we have on phone now Alfred Obengo, who is the chairman of the National Nurses Association. Many thanks for joining us, Mr. Obengo. What do you make of this crisis and the fact that nurses were the first to be blamed for the mistake that happened? Mr. Obengo, if you can hear me, many thanks for joining us on the big story tonight. Nurses had initially been blamed for the incident where brain surgery was conducted or performed on the wrong patient. What response does the National Nurses Association have? All right, we seem to be having trouble communicating there with Alfred Obengo, who is the chairman of the National Nurses Association. We'll be joining him in just a moment. But Dr. Omar Oluga, let me come back to you. When we came back from the break, we've heard from James Miano. He is the father of a man named Angelo, a man who the family claims was the one who should have undergone the brain surgery, but has since passed away. The Kenyatta National Hospital, however, initially maintained that both patients were in stable condition. What more can you tell us as to the fate of the patient who should have undergone the surgery?
I think first is to pass our condolences, but also to say that I think the hospital is in a better position to comment about which patient here is. I think as you have noted, the hospital came out and said that the patient that ought to have gone through the surgery is not the one that apparently passed on. And let me just say that concerning the question that you are asking, I think, Alfred, before you didn't get him, the health system should work as a team. That's part of issues that need to be strengthened. Quality management systems involves teamwork, involves people operating as a unit, because you provide one service. I think there is no one specific cadre that is able to say that we can provide health on their own or health service on their own. And therefore, this is also an advice to health workers. And let me make it very clear to every single health professional and every single health worker out there. This era of superiority, division is long gone. Stop it, and stop it forthwith. I think we have to develop teamwork in healthcare, and we have to deliver value to patients. And delivering value to patients means that we must work as a team. And I think I want to repeat that again to all health professionals, that the reason why you work in a hospital is to deliver value to patients, not to start this throwing of stones this side and that side. I know that that should be, you know, there's a lot of things. There's something called health worker accountability. And health worker accountability is usually instilled through supervision and support. So when you supervise health workers, then you develop care teams to deliver a specific health service. And then you support them with the necessary tools that they need to ensure that they work as a team. Even though those are system issues, I think then the health professionals must also begin to go towards a situation where they will be able to work as teams and be able to deliver value to patients. I think part of the things that are broken down in the healthcare system, and I'll say it without fear of favor, is that the care that we give as healthcare workers is not integrated. And this is causing patients a lot of pain, it's causing patients a lot of harm, it's causing patients a lot of delay, and it's causing patients a lot of money. And I think every single health professional better hear this very well. They have to work as teams.
It has been laid across. I'll come back to you just a moment, Dr. Oluga, because we need to discuss the impact of the 700 registrar doctors that have since downed their tools. But Mr. Obengo, Mr. Alfred Obengo, chairman of the National Nurses Association, is live with us on phone. Mr. Obengo, you seem to think that doctors should take responsibility for the latest saga at the Kenyatta National Hospital. Tell us more.
Thank you, Michelle. I want to say first that we welcome the directive of the Cabinet Secretary of Health, Cecil Kariuki, on the issue of undertaking a thorough investigation into the matter on behalf of public interest. But he also quick to remind Kenyans that there is no quick fix to the healthcare delivery system that is going on at the country as today. We still believe that the incident, and especially where the nurse is being accused, that these are just victims of a compromised system in the healthcare delivery system. What I will urge is that we need national dialogue to address the real issues that are affecting the public health delivery system. Actually, somebody once said that you don't find simple solutions to complex problems. And these are very, very, very complex problems. And I want to add that when you want to look at quality healthcare and actually service the patient, it goes hand in hand with staffing ratios, and especially of nurses. We have a situation whereby we have the lowest staffing ratios in the public healthcare delivery system of nurses. So that is an issue that should be looked at very critically so that we can offer quality healthcare to patients. And actually that goes along also with their safety, because you cannot have a quality healthcare system with a staffing ratio that is below par. Insofar as the incident is concerned, I want to welcome the sentiments from Dr. Oluga, my brother and a friend, that actually something went wrong, and that is why the investigations have been launched. And we pray that the investigations will come out with the real issues that are bedeviling the healthcare system.
All right, and where then, in your case, do we begin rectifying Kenya's, public health system, especially in terms of patient management?
That's why I said we need a national dialogue of all stakeholders to be brought on board so that we can identify the real issues, the causes, and where the rain started beating us, insofar as public healthcare system is concerned.
Right, let me come back to you, Dr. Oluga. At some point, you said, doctors and nurses do not make up the Kenyatta National Hospital. But I beg to differ because, at the end of the day, many would go to the Kenyatta National Hospital because of the doctors and nurses that are available there. But let's, discuss the 700 registered doctors who've now downed their tools in solidarity with their colleague who was then suspended. And that is the neurosurgeon. I understand the registrars are now demanding that the consultant who oversaw the bungled operation then be suspended instead. Let's discuss the impact of this strike on the healthcare system in days to come.
First of all, Michelle, I think also is to correct the notion that there was a consultant who oversaw a bungled operation. And secondly, also is to correct the, I think, misinformation that, that the registrars are saying that a consultant should also be blamed. As a matter of fact, we had held a meeting today where all consultants were available from the Kenyatta National Hospital. Equally, those consultants who are also professors and lecturers from the University of Nairobi, and also all the registrars. And none of those issues were discussed, neither were they raised. I'm not certain where the media got this report that the registrars are also saying that the consultant should be punished. What the registrars are saying is that the suspension is ill-advised, and that even though we do acknowledge the error, it's not an error that is of professional nature, and that means that then it's not an error that can be that can lead to a ruining of a professional career. And what we are saying is that those colleagues that were suspended needs to be reinstated immediately, and that's not bargainable with anyone. And what we are also saying is that the registrars are also saying that then, now that the Kenyatta National Hospital has exposed them and also put them on the path to danger and harm, including a collision path with the public and also with the patients, they also want to offer the best care. And that best care they can only offer when they are supervised, and then when they are supported by their senior colleagues who are the lecturers. And those lecturers are on strike. And they are saying that when those lecturers come back, then they will be able to offer that service that they offer. Kenyatta National Hospital, and by extension MTRH and Mathare Hospital and all the other teaching and referral hospitals, rely on a cadre of doctors that we call registrars. These registrars are the slaves of these hospitals. The other slave of the hospitals are only the interns. And these doctors are the backbone of these hospitals. They work day and night. But then if the hospitals are not going to recognize their services and are going to treat them with the contempt that they have done, including during this case, then it is only proper that these doctors work when their senior colleagues who are their supervisors are back in those hospitals. Because there is absolutely no obligatory arrangement between these doctors and these hospitals. As a matter of fact, even the student neurosurgeon and the colleagues who are suspended, they don't have any contract with Kenyatta National Hospital. Kenyatta National Hospital is misleading the public by saying that they have suspended someone, because this doctor has a contract with the University of Nairobi. And one of the things that we are also saying as a doctors' fraternity and as a union is that the memorandum of understanding between Kenyatta National Hospital and the University of Nairobi, and that between MTRH and Moi University, must be reviewed to look at three main things. One is the obligations that the hospitals have with the doctors. Number two is to look at this patient safety and SOPs that we are talking about. And number three is to review the postgraduate training program in totality. So that is what we are talking about. I think, I hope the public has got it clear. There is absolutely no blame game amongst the doctors themselves. And we are also advising all health professionals that it is time to work as a team. Our patients come to hospitals to get care, not to know who is who and who can deliver what. So it is important for health professionals to start developing teamwork and to start delivering the value that patients want. That is possible when systems also support them, but even before the systems support them, we as the leaders of the health professionals, we will advise health professionals to begin these measures by themselves. So the registrars have withdrawn duty, clearly stating that they want their colleagues reinstated, and more importantly, that they cannot work without the supervision of the lecturers for whom they came to school to teach them, because then that leaves them exposed and unprotected in case of complications as these ones that have happened.
All right, many thanks. Let's also hear final closing comments from Alfred Obengo. He's the chairman of the National Nurses Association. What are your thoughts, especially when it comes to accountability in cases like this?
My thoughts is that we need teamwork. We need to improve the working environment, especially at the clinical area. And actually, we need more funding insofar as healthcare delivery is concerned, and more staffs. Staffs must be employed You cannot expect patients to be taken, an average of 100 patients in a ward to be taken care of by 2 nurses or 1 nurse. So we need more nurses to be employed so that they can give their services the quality, not just services, but qualities, professional services as prescribed by the regulatory body, which is Nursing Council of Kenya. As of now, it's very difficult for us to operate within our scope of practice because of the challenges we have in our working environment.
All right. Many thanks for joining us. We've been speaking to Dr. Oma Oluga, Secretary General of the Kenya Medical Practitioners and Dentists Union, as well as Alfredo Bengo, Chairman of the National Nurses Association. A big story tonight is patient safety and management in the country, and a clear need from this conversation to streamline the implementation of the county health referral system, as well as teamwork, especially within the medical teams. That brings us to a close on the big story tonight. Many thanks for watching. My name is Michelle Ngele. Do stay tuned to KTN News at 9.